Hi, Tina Michelle. My name is Ala Michelle, and I will be a clinical nurse specialist. I'm going to be closing your door for privacy purposes, sanitizing my hands for hand hygiene, and I will be starting my assessment. Any problems today that brings you in at all? Awesome. Well, we'll complete this assessment. General survey, you seem pretty. You are a 24-year-old female, no known drug allergies. You don't seem like you're in any distress. You're pretty calm. Your breathing is relaxed, which is great to see. No cyanosis noted. Skin's within normal limits and appropriate for ethnicity. I will be moving on to inspecting your head, your eyes, your ears, nose, throat, along with palpating a few assessments and doing a few tests with you, okay? So since I do see that you're wearing a religious head cover, I'm assuming it's for religious purposes. Is that correct? Awesome. So since I can't really assess your skin or your scalp or your hair, I just have a quick question. Do you sometimes feel like you're always itching your hair or itching your scalp? Okay, so no signs of lice noted. Do you also have, do you feel any weird bumps or bruises on your head at all? Okay, so no lesions, no bumps noted as well. Your skull seems to be contoured symmetrically. The size of it seems to be normocephalic, which I don't see any concerns there. And like I said, your facial expressions are also symmetrical as well. And just like back to what I said, your skin color of your face and your head is appropriate for ethnicity and is within normal limits. I am actually going to be moving to assessing for your ear. I'm going to be doing a whisper test. Have you ever done that before? Awesome. So what I'm going to need you to do is I need you to stand up for me, please. You're going to be 2 feet away from me. I'm going to stand behind you. It'll be at arm's length. And the reason why I'm behind you so that way you cannot see what I'm saying. You can't, you know what I mean? We can't note it.
Okay.
I'm going to be saying a number of letters and words, numbers, a combination of numbers and letters.
Okay.
And they're up to 6, okay?
Okay.
Let me know what you hear.
Okay.
Oh yeah, I need you to block one ear.
Okay.
So you're going to block the right ear first.
Okay.
Put your hand over your ear. Thank you.
4K2.
Awesome. I'm going to say another one again, okay? 8K6.
8K6.
Awesome. Perfect. So the right ear passed. Now we're going to do the left ear.
782.
782. Yes, correct. And then I'm going to do one more.
8Z6.
Awesome. All right. So both ears passed. We're going to have a seat down. So you actually passed the whisper test.
Thank you.
Congratulations. We're going to move on and we're going to check your pupils. So I'm actually going to take a flashlight. We're going to see, I'm going to look at the size of the pupils. Have you ever heard of PERLA? Okay. So pupils are equal, reactive to light, and accommodation as well.
But I didn't really sleep that good, so.
All right. Oh, I know. I'm sorry. Well, I'm going to be really quick as much as I can. I apologize about that.
Okay.
So what I need you to do is we're going to look at direct reaction and continental reaction. So what that means is I'm going to see the constriction of your eye, of both your eyes when the light is passing on them. Did you have a long shift today?
I did.
That's why. I'm sorry about that.
That's okay.
Well, we're almost done our assessment. So I need you to close one eye first, and we're going to open the other eye. And I'm just going to look straight away. Open your eyes. Awesome. And then close the other eye. Okay. So obviously both eyes are PERLA, pupils equal, reactive to light, and accommodate. And then I'm going to do the whole direct and continental reaction. So you're going to keep both eyes open. I'm going to look at this eye, and I'm going to see if that one constricts with this one while the light is just lit up on this eye, and then vice versa. Does that make sense?
Mm-hmm.
Okay. Look straight ahead at me. Awesome. So this eye, your right eye constricts when the left eye, when the light is the light is at it. I'm going to do the other eye as well. And that's the same thing. So they both constrict, direct and consensual. So we're actually done with looking at your pupils. And now what I want you to do is I want you to stand up for me, and we're gonna check your extraocular muscles. Is that okay?
Mm-hmm.
Thank you. So you're gonna stand 2 feet. We're gonna stand apart, and you're gonna face me, And like I said, we're basically going to be looking at the extraocular muscles. And the reason why we want to do this is because we want to prevent seeing any lid lags or any strabismus. So the first thing I want you to do is read 2 feet, and you're going to be basically, I'm going to assess you for the extraocular muscles. We're looking for any lid lag and any for strabismus.
Okay.
All right. So you're going to look all the way to the right.
Mm-hmm.
And then we're going to go all the way to the right and upward. Awesome. And then we're going to go all the way to the right and all the way down. We got the alarm going on. And then we're going to go back and we're going to go all the way to the left. Awesome. And then all the way to the left and upward. And to the left and downward. Awesome. You can have a seat. So Dima was able to perform the extraocular muscles appropriately. No lid lags and no strabismus was noted when completing this. We're going to move on to the fun part, which is your oral assessment. So basically, I'm going to be assessing for your mucosa. I'm going to need some supplies. So I'm actually going to put on my gloves. We're going to look at your mucosa, and we're just basically looking at the palate of your mouth. And it looks great. So your mucosa shows pink in color. I didn't see any ulcers at all. The roof of your mouth looks normal to me. I don't see any lesions, no white patches, no nodules at all. The next thing I want you to do is, and then I want you to open your mouth again because I gotta check for any tonsils. And I do not see any tonsils at all. So that's great to see. Your uvula is also in the midline, as I noticed when I looked in there. And like I said, the roof in the top, the roof of your mouth is within normal limits. It's pink and great in color. So what are we gonna do now is I want you to look at me, and I'm gonna be assessing for your pharynx. So what I want you to do is I want you to say ah as much as ah. Okay, so your pharynx is actually great. It's soft and pink. And basically when I did that, we were checking for one of the cranial nerves, and it's known as the vagus nerve. So that vagus nerve was great. The next thing we move on, we're going to do the lymph nodes. There are 10 lymph nodes I'm going to be palpating for. If you feel any tenderness, please let me know, okay? So we are going to be checking for the submental, which is the tip of the mandible, submandibular, which is the midline of the mandible, preauricular, front of the ear, postauricular, behind the ear, tonsillar, which is the angle of the mandible, occipital, which is the base of the skull behind you, anterior superficial cervical, which is your supraclavicular mandible muscle, which is the front. Then we're going to do the posterior cervical, which is the neck. Then the deep cervical chain.
That hurts.
It hurts a little bit?
A little.
Okay. And then you have, I'm sorry about that. And then you have your supraclavicular clavicle, that's where the SCM nodes is. Did that really hurt where I was? Oh, okay. Maybe it was just a little thing.
Yeah.
Okay, all right. So basically no tenderness noted upon any of her lymph nodes. Awesome. We're going to be inspecting for your thyroid gland. What I need you to do is I need you to look straight ahead. And I'm going to shine some light on your thyroid, and I want you to on your neck, and I want you to swallow for me. Awesome. Awesome. So your swallowing seems pretty symmetrical to me. Next thing I'm going to do is I'm going to go behind you, and I'm going to palpate.
That's amazing.
So I need you to put your neck forward, and I'm going to be palpating the back of your trachea and I'm going to be palpating your trachea and your supraclavicular muscle. Any pain?
Mm-mm.
Okay. Now what I need you to do is I need you to look straight ahead towards me. And like I said, just swallow again one more time. Awesome. So the size, the shape, your contour, everything seems to be symmetrical. And I don't see any nodules at all, or any lesions or any bumps. So you're negative for that. And then now what I'm going to do is I'm actually going to be listening for any bruits. And if I do hear any bruits, that means there might be some enlarged thyroid that's going on that we have to probably rule out, okay? So I'm going to be switching my stethoscope to the bruit side. so I don't hear any brutes. Great. Now I'm going to move on to the carotid arteries. We are going to be listening to both of your carotid arteries, and we're going to be also listening for a brute, just like how I did with the thyroid gland. We're going to do it with the bell for 10 seconds, and then we're going to do it with the diaphragm. All right? So. Right? I did not hear any brutes for 10 seconds with the bell. Now I'm going to change it to the diaphragm. Awesome. So no brutes heard on both ends. Next, I'm going to be palpating your carotid arteries. I will not be doing them at the same time because we don't want any issues there. So I'm just going to be palpating over here with 2 fingers, one at a time. And now the other one. Awesome. So you actually have great pulses in your carotid arteries, very bounding, +2, and they're great. Next thing I want to do is I want to talk about your range of motion. So we're going to do just a really quick one. It's not going to be anything crazy. For your head, I just want you to turn to your left with your head, then your right, back, front. Then I want you to lift up your shoulders, up, down. All right, and then with your neck, I just want you to move around in a large circle for me. And then the other way around. Okay, awesome. So range of motion seems perfectly fine. Symmetrical is normal, and no problems noted. Alrighty, so now we're going to move on to the posterior. We're going to move on to the respiratory system. So the first thing I'm going to do is I'm going to be listening for your breath sounds. It's going to be the posterior breath sounds. So before I do that, I want you to give me a huge, huge cough so we can clear up any secretions that's going on in here. Bigger cough. Okay, awesome. All right, so now I'm going to be listening to your lung sounds. Face the wall over there. So I'm listening for her posterior breath sounds. And just take deep breaths in. Deep breaths in. Deep breaths in. One more. All right, so in the left lower region, I did hear an abnormal sound. So what I need you to do
Does that mean I'm dying?
No, it does not mean you're dying. But what I need you to do is what I need you to do, I'm going to listen to it again, but what I need you to do is I want you to say E, okay? E. Awesome. So you're actually negative for egophony. Egophony is basically a sign of pleural effusion or a sign of a tumor.
I have a tumor?
You don't have a tumor. Because usually patients that say, instead of saying E, they say ah. That's when it'll be a sign of a tumor or a large pleural effusion, which you are negative for those. So, pat on the back. Now I need you to face the front over there, and we're going to listen to your anterior breath sound. So I'm going to be listening to your breath sounds, and we're just going to be listening to the front.
Mm-hmm.
And just deep breaths in. Deep breaths in. Deep breaths in. All right. So no adventurous sounds, no rails, no rhonchi, and no wheezing noted. Awesome. I'm actually going to be listening to your heart sounds. They're pretty easy, not bad at all. We're going to be listening to 5 sounds. So thank you for laying down this way. So I'm going to be listening to your aortic, which is in your second intercostal space, your pulmonic, which is on your second to the left intercostal space, Erb's point, which is your third intercostal space on your left side, tricuspid, that's the fourth intercostal space on your left side, and your mitral valve, which is in the fifth intercostal space, located at the apex. I'm going to be listening with the diaphragm first. Awesome. And now I'm going to be listening with the bell. Awesome. So your heart sounds are normal. S1, S2 heard. No S3, no S4 sounds, no murmurs, nothing abnormal. Next thing I need you to do is I want to be able to rule out an aortic murmur or any stenosis. So what I need you to do is I need you to actually lean forward for a few seconds, blow out all the air that you can. Oh, that was exaggerated. And I need you to hold that air in, and I'm going to be listening to your heart sounds in the right upper sternal border. Awesome. So no aortic murmurs noted. Now I want you to lay down flat, and I'm using the bell. I'm going to put it again in the right upper sternal border, and do the same thing. Blow out air and hold. Alrighty, so I actually did not hear any mitral stenosis, no mitral murmurs, no S3, and no S4 sounds. Next thing we're going to do is we're going to assess for your JVP. So your JVP is basically assessing for any distension. So I need you to turn around this way, and I'm actually going to elevate your head at 30 degrees. So since we don't have a moving bed, I'm going to put this pillow behind your head. Yeah, it's okay. Your JVP, which is your jugular vein distension. So I need you to lay down, and we're going to be checking for your right internal jugular or your external jugular vein. So it's going to be using two rulers. We're going to assess it from here, 2 rulers, and awesome. So no distension noted, no venous pressure noted as well. So you are not elevated. You seem pretty normal. So that's good to hear. So we're actually done with this assessment. Just to go over everything, there's no skin lesions that I find on you. And we're done. Thanks for your assessment.
Thank you.